Irreverent, entertaining, cool. You're listening to LA Talk Radio.
You're listening to Sam in the Morning, only on LA Talk Radio.
Good morning and welcome to the show. Today's Friday, August 26th. Almost the end of August, Tori.
Almost the end of August.
Yes, we'll be coming back next week and we'll be looking at September. Mm-hmm. Yes. How you doing, Tori?
Good, how are you?
Good. We have a nice overcast morning. The end of this heat that we've been having
Finally,
here.
that's right.
Yes, and we are truly appreciative of that. Whoever's responsible for the weather, thank you. We appreciate that. In a few minutes, we're going to get to our guest, a very fascinating guest, and it's going to be very interesting. A couple things. Have you probably heard of this Leslie Jones thing?
Oh, yeah.
First of all, tell me who she is. I don't even know who she is.
You're adorable that you don't know who she is.
Really? Why?
Yes, because she's all over this year. So she's
Really?
this 48-year-old comic, and she went and got on SNL. And she's fantastic, and
Really?
she does a lot of like screaming rants at the desk pieces. She's very funny, and then she got starred in Ghostbusters, the female remake.
Oh,
And then she started on this weird like anti Leslie Jones Twitter troll. People started for some reason targeting her, and she got so upset that she had to leave Twitter. And then she started making a new account of her watching the Olympics, and NBC loved it so much they hired her, and she went to Rio, and it was this resurrection, and she was tweeting again for USA, and she was great. Everyone loved her. And then all of a sudden this week, those trolls hacked into her account and posted nude photos all over her LeslieJones.com website, and so now she's had to take that down. She's just it's a weird victim. She's become a victim of all the hacking and the trolls all on her.
Yeah,
it's a weird target, but she's been just raked through the coals with these trolls.
Yeah,
I didn't mean to rhyme that.
No, my question is, what nude photos of hers? Mm-hmm. Really?
Yeah, and it just they hacked into her photos.
Photos and
yeah.
stuff.
And she's this really cool, dignified, awesome woman. At one point, no one would dress her for the award ceremonies, so she tweeted it out. And then Christian Siriano of Project Runway was like, well, I will. And she slayed in this red off-the-shoulder trumpet. Ugh. She looked phenomenal. Really? So she's got this, like, she keeps getting pushed down and then back up again. But I don't know why she's become the target of internet hacking.
Bullied, huh?
It's very weird, but she alone has had, like, a remarkable amount.
Wow.
Of cyberbullying.
Maybe she pissed somebody off. We never know, you know?
It's very weird. Very
yeah.
hateful racial death threats. I mean, it's very weird.
Oh, really? So it's race-based, do you think?
Very, very, very
Really?
racist.
Oh, so they made like comments and stuff about it?
Terrible. For the
Really?
whole Twitter thing was racist. Then this new hacking thing was racist. It's so bizarre.
Yeah.
It's just weird.
Wow. And she's a woman too. It may have to do with that too, you know?
I know, but she's this like cool, strong,
Right.
independent, like stand-up
That's what
comic. What are you doing with that?
Yeah,
no, she's not hurting anybody.
Yeah.
I don't get it.
I know. There's so many haters out there, you know. You just gotta, and they all come out on the internet, you know.
The
It
internet.
gives them such a platform to be on. But I feel bad for her. But it just goes to show you, man, don't keep nude pictures of yourself anywhere. Why do you need those, you know? Send them on, don't take them all.
You don't
at
take
all.
nude pictures of yourself?
No.
It's a shame.
No, I don't take nude pictures of people I'm with either.
Okay.
Yeah, because you don't know where it might end up.
That's true.
You know?
No, it's true.
Yeah, I mean, these guys all send like dick pics and stuff like that. You know, I mean, what is that? You know?
Yeah, you got to be careful. Everything is readable now.
Yeah.
Nothing is being thrown away.
Exactly, yeah. But, you know, what can you do, man?
Yeah.
What can you do? So I feel bad for her, but... apparently there's a lot of support for her.
Now,
which
yeah,
you
that
can
now in the
understand.
comic world, there's a ton of support for a feminist world. There's a lot of support for like Black Lives Matter and women and people who aren't racist. There's a lot of support. So it only brought her back into the public eye.
Right.
So it's great for her, but she just went through the rakes. I mean, terrible things were said.
Yeah. That's terrible, man.
And I get it if she's a controversial figure, but she's not.
Yeah.
She's just like a stand-up actress. Weird.
Well, we'll see what they're going to do to Donald Trump.
Good God.
To his website.
Oh, God. Please, someone find something. Please.
Richard Branson crashed his bike.
Oh, really?
Thought he was going to die. Look, that's a pretty bad picture they're having of him here. I don't know people riding bikes, man. I'm not one for them.
Was it a motorcycle or just a bike?
I think it's a motorcycle.
Oh, yeah.
Yeah, right?
Yeah.
I mean, I don't know.
Maybe he was bicycling.
Yeah, maybe he was. I don't know what the hell's going on. But crashes his bike. Yeah, I mean, if you crash a bike, it's probably a motorcycle, don't you think?
Yeah. I mean, it's a little wimpy if it's just like,
His
I was
bike hit a
cycling
speed
alone
bump.
in the woods.
Yeah.
Yeah, just bicycle.
No, actually, he was cycling. I'm
There you
sorry,
go.
you're right.
I thought so.
Yeah.
That's right.
So he hit a speed bump and it threw him in the air.
We've all heard of Formula One, but
And I hate these videos that start playing right away.
Yeah, that's really annoying.
Yeah.
And you don't know where they're coming from.
Yeah, exactly. And I just lost my story here, but there was something about the iPhone being hacked.
Oh yeah, the update or something.
Yeah,
I always
they
wait
put
on
up
an update. I always wait on an update for like 2 weeks because always there's a bug and then it's like worked out.
Right, but now people are hacking iPhones to. They're saying actually, you see, this Israeli company made the software that allows people to track another person's mobile phone.
Oh.
So they're saying that some government organizations or whatever have been following people. So
That's
governments,
not news. We know that.
Yeah. But just beware of what you put on your phone. You know,
Yeah, naked. They're looking at your naked pictures. The government.
exactly. What is it? Naked pictures and all this stuff. Don't put that stuff on your phone, man. It's just too vulnerable. You know.
There you go. Protect
it's
yourself.
Too vulnerable. Exactly.
You hear about the EpiPen?
I've heard something about that. What is it like? They raised the price a lot. Or
Yeah,
something?
and then this chick started just like a little, tiny little petition online for her like 800 Facebook friends and was like, hey, stupid pharmacy company, they raised it like $600 to $600 an EpiPen.
Wow.
And if you have severe allergies, you need one at school, one at home, one at the car.
Oh, really?
'Cause you'll inject yourself if you have an allergy.
Right.
It used to be like $190 for two. Now it was $600. Ambulances couldn't afford it. So, and they did it for pure profit. So she sent this stupid little Facebook petition and it went viral. And they
Really?
changed it.
Wow.
And now it went down in price. Like Clinton said something. I mean, it's great.
Yeah.
Good for her.
There you go. You see, sometimes people can do good things too.
Social media.
$500, man. They have no qualms about it.
No.
Yeah.
And it's bad. And it was like literally for greed. There was
Yeah.
no other reason. And these people like can't hardly afford. I mean, you need if you need an EpiPen, you need it everywhere. You know,
Wow.
it's crazy.
Yeah. Very bad stuff. War still going on in Syria. I guess 11 children died in an airstrike. And that's what's called collateral damage, and that's unfortunate. But kids are dying, people are dying, and I don't think it's going to be over anytime soon. There,
No, I think it's
it's probably never going to be over.
It's a very hard knot to untangle, and it's going
Yeah.
to take a lot of patience and a lot of level-headedness, which is so Trump, isn't it?
Yeah, I guess
I'm
it
just
is,
kidding.
right?
No, I just mean I think it's a very sensitive knot. I picture the Middle East very sensitive knot right now, and it takes someone very cool, level-headed.
Yeah, well, it always is.
Yes.
That's what the Middle East is about.
Yeah.
You know, if it was peaceful there, it would be too boring, I think.
Yeah,
Yeah.
that's true.
All right. Well, so we have a weekend coming. I'm looking forward to that. Get some rest and stuff, which never hurts. Mm-hmm. Never hurts at all. And we're going to bring in our guest right now. Let me just bring up his website real quick. And we're joined by Dr. Babak Dadvand. Did I say it okay?
Absolutely perfect.
Great. I've been practicing it this morning since you told me so. There we go. Thank you. Thank you for joining us.
Thank you, Sam. Thank you, Tori, for having me.
Of course. So you're a Los Angeles, Beverly Hills doctor,
Yes.
a plastic surgeon?
Yes.
Okay. So, well, we'll get to all that and stuff, but a little bit about your background and everything. Are you originally from L.A.?
No, I was actually, I was born in Iran, but moved to the States when I was 4 or 5, but grew up in Philadelphia, so I'm an East Coaster.
Oh, really?
Philly.
Yeah.
Good old Philly.
Yeah.
What was it like growing up there for you?
Yeah, I mean, it was a great childhood. You know, it was,
Yeah.
both my parents are doctors, and so it was kind of entering the family business, so to speak. But I had a great childhood. You know, it's the East Coast is definitely a different vibe and energy than the West Coast, and not in a good or bad way, just a different way.
Right.
You know, but I moved to the West Coast about 10 years ago to Los Angeles Purely for the weather, to be honest with you. One of the things about the seasons is that Southern California, we celebrate the two best seasons, which for me is spring and summer. So.
Yeah, there you go. If we get a spring here, But sounds good. Do you have any siblings?
Yeah, so I have I'm the oldest, and I have a sister and a brother. My sister's also a doctor, and my brother's here in L.A., trying to make it as a director and a screenwriter.
That guy. So there you go.
And I'll tell you a little interesting story too, because my parents never wanted any of their kids to be doctors. Okay,
really?
They wanted me to. I was a violinist and a painter. They wanted me to be a professional violinist.
Wow.
They wanted my sister to be an English professor, and we both become doctors. And we kind of joke with our parents that, our little brother is the only one that made mom and dad proud by going into the arts. So we're the disappointments.
I like your parents.
Yeah.
I know everybody says go become a doctor.
Oh my
They're
God.
like, go be a violinist.
Right.
Yeah, I mean, that's the other way around.
Yeah, it's
That's
crazy
cool.
for Iranian parents to want their kids to go into the arts.
So rare.
That's true. Now, were you the creative type when you were younger?
Yeah, definitely.
So you did play violin?
I played for about 15 years.
Wow.
It was actually pretty good.
Yeah.
but
That
I
means
just-
really good. When a violinist says, I was pretty good.
yeah, but I just never saw it as my calling or something I want to make a living at. And in undergraduate, I was actually a fine arts major, so concentrated in oil painting. So it's always kind of been this yin and yang with me, and this kind of schizophrenic approach to the arts and the sciences, and why probably subconsciously I started to shift towards plastic surgery.
Yeah, because it's a form of art in a way.
Absolutely.
In a very interesting way.
That's true. Huh?
You
You,
know what
get
I'm
to
saying?
sculpt people.
Yes. Very true.
Wow, that's very interesting. So now I wanted to ask you, coming from a different country, we were talking about bullying and stuff. Was it difficult for you? I mean, did people give you a hard time?
Yeah, I think I grew up in the late 70s and 80s, and I can look back and say, I was bullied a couple of times. I didn't look like most of the other kids in the school, and I didn't even really realize I was being bullied until now that I have my own kids. And there's such more awareness about issues like this now than in my generation when I was younger. And looking back, I'd say, I actually was bullied, but just kind of brushed it off as being teased a lot.
Exactly,
I was
and you're young. Maybe you don't even understand why or anything. You're just like.
Right.
You're just bullied. This is my life, and that's it. And it's unfortunate, but I think every kid goes through that.
I was bullied
right?
for being a teacher's pet. Yeah.
Really?
Mm-hmm.
Wow.
Yeah.
I can see you as a teacher's
I know.
pet.
Whatever. Fuck you, man.
This is his interview. We're screwing it up now. You'll have to take it out if you want to put it on your website. But no, this is the kind of show it is. We'll try to keep it clean. But
darn it.
Yeah.
Darn.
And so where did you go to school, to college?
So I went to University of Pennsylvania in Philadelphia. And,
Very good school.
Yeah, it's not bad. And then graduated from there and went on to med school, and then general surgery residency, and then plastic surgery. So
Wow.
I was in school for a long time.
That's a long time,
yeah.
huh?
It was 12 years after college.
Wow.
12 years
That's
after
right.
college.
After college.
After the 4 years of college.
Yeah.
12 full years. Wow.
Yeah.
And you can't work during this time in what you're studying, or
So after medical school, you're a resident. So you're working. You're basically cheap labor. But that's also when you're learning your craft as well.
Right.
So that was 8 years of training. And so yeah, you're making a living wage, so to speak.
Right.
But it's really where you hone your skills and you
Yeah.
learn the surgeries and your craft and your field. So
yeah, and it's very important, obviously, to go through a lot of experience and years with this. It's like almost like flying a plane. You need like 1,000 hours or something. Because you're dealing with people's lives, right?
Absolutely. It's
Yeah.
they say that the number 10,000 hours in any profession to become an expert in that, right? So we definitely put in our hours in those years.
Wow.
I would rather have someone like to be
2,000
honest, if I was getting plastic surgery, like if they were like, this is just a plastic surgeon and this is a violinist / oil painter who is also a plastic surgeon, I'd be like, that one. I'll take that one. I'll prefer that one. I mean, it's a certain, flair to it, nuance to it. So that's cool.
Yeah, unless he was like really a lover of like Dali and Picasso and Cubism, right?
Yeah, that'd be terrible.
Maybe
one eye over
you don't
here.
want two eyes on the same side of the face,
No.
right?
No, very interesting though if it were.
Yeah, but you did have some time to study painting and paintings
Absolutely.
and things like that.
Yeah,
huh?
yeah.
That's very cool. So you understand the human body, the way it looks, and
I think
that would help.
So you certainly don't need to be able to draw or paint to be a fine plastic surgeon. I think what it helped was it trained my eye, so I can look at someone and verbalize everything that they may seem or they may feel is off, but they can't really put to words. And
You're my worst nightmare.
I can easily verbalize it, and also understanding three-dimensional spatial relationships. So in the operating room, it's really important. And I think that was more not from my painting, but from my sculptural background when I was studying. You have to look at the body and the face from 3 dimensions. It may look good from one angle, but then from the other, it may not be as good. And so sculpture is very similar to that.
Sculpture, more than painting. Yeah, for sure. Wow. So now, what attracted you to plastic surgery? I mean, there's obviously it's a huge medicine's a huge field.
Yeah.
And sometimes I'm curious why people make certain decisions. So what drew you to that?
So it's interesting. When I first went into general surgery training, I wanted to be a vascular surgeon. Sewing up blood vessels and doing bypasses. And then during my training there, we were able to rotate on the plastics service.
Because you do a rotation, right?
Yeah,
different things.
Right. And the plastic service they put us on was the reconstructive service, so no cosmetic. And what really struck me was that they're seeing a problem, right? A patient has a problem, and you can come about a solution from different angles, and you don't feel like just such a mechanic. You can be creative and think outside the box to get the patient to their final solution. And that started maybe subconsciously playing to my creativity as far as the fine arts background and trying to think outside the box. And I then did another rotation in plastics later on in my general surgery residency and really enjoyed it. And again, none of it was cosmetic. It was all reconstructive. And I really enjoyed being able to see a problem and think of different ways to fix it.
And then see the result. I mean, that's the cool thing about it, right? He gets almost an immediate result once they're done healing.
Right.
Yeah.
And the patient's lives are changed forever.
Right. And so I think that's what drew me to it initially. And I think it helped, obviously, that I had a fine arts background, but it wasn't my master plan when I was graduating high school to be a fine arts major and then become a plastic surgeon.
Sculpt real people.
He's like Dr. Frankenstein.
That's right.
That's funny.
Yeah. So you started your practice back in Pennsylvania?
No, I started here in 2007.
Oh, I see. Yeah. Okay, so you moved right away after that.
Absolutely. I mean, when you live in cities like Philadelphia, Pittsburgh, Cleveland, Indianapolis, you realize life is short, and the weather, those are great cities, but the weather
is brutal.
There's a lot to be desired,
And
brutal.
that's what amazes me is even people that are born and grow up in that weather, they never get used to it, you know?
It's brutal.
Yeah, it's like you would think, okay, so it's always been cold. You don't know anything else.
Right.
But no, you can't stand it, huh?
Yeah, and my parents are still in Philadelphia. I love Philadelphia. I'm the biggest homer for the sports teams. But every time I go back to visit, whether it's in the summer or in the winter, I'm like, how did I ever live here for 20 years?
It's dreadful.
It's either the snow or the humidity. And Tori, growing up in Washington, D.C., right?
It's built on a swamp.
Yeah.
Literally. But built on a swamp. The Washington Monument sinks a little each year and that's how humid it is in August. I feel like I'm in a bog.
Yeah.
Really.
Wow, I didn't realize that.
It's almost 100% humidity for the month of August. It's like you walk outside and you're just wet.
Yeah.
Yeah.
Wow, that's terrible,
Yeah.
man. So,
but it's a lovely city.
No.
Yeah.
I love D.C. as well.
It's great.
Yeah.
It really is. In springtime, it's delightful.
That's the best week of the year, right?
The cherry blossoms. Tourists, go somewhere else. No, I'm just kidding.
So when you were thinking plastic surgery, did it occur to you also that probably in L.A. you'll have a bigger market?
It's interesting. There's a plus and a minus to practicing in Beverly Hills or Los Angeles. Obviously, as a city or as a town, it's very open to plastic surgery, always has been. But there's also a lot of competition too. A lot of plastic surgeons, a lot of people who aren't plastic surgeons who are trying to do plastic surgery as well. Wow. And so you're competing with all these people. But I always say, the cream always rises to the top. And if you're good at what you do and you're a good doctor and a good person, you'll be fine wherever you go.
Yeah.
And I had a mentor back in my plastics training. He told me, he's like, Bobak, just pick where you want to live and then build your practice there. Don't build your practice just out of convenience for another reason. You're good enough that wherever you decide you want to live, you'll be successful. And you'll also be happy because you chose somewhere that you actually enjoy living.
Like the great words of Field of Dreams.
That's right.
If you build it, they will come.
Yes, ma'am.
That's right. But that's so true. That's great. Make your dream, do it, plant it, it'll happen.
Right.
Yeah. And like you said, you got to be good. You got to be, I mean, especially with things like this.
Oh my
When
God.
people botch those surgeries, man, it looks awful. You're ruining somebody's life.
100%.
Right?
Yeah.
Yeah. So, I mean, that's got to be, I mean, you must be pretty confident in your ability by this point to say, I can do this.
Yes.
Yeah. And not botch it or anything. My God.
Right. And
so are those like the
confident,
people that
but not confident, but not
Cocky.
Right.
Because once you get that arrogance, that's when you start making mistakes.
Really?
Um,
Yeah. Now, those that do all those botch jobs, are those the doctors you're describing as that are not plastic surgeons, but they're doing that anyway?
No, I wouldn't say that. I
no.
mean, listen, I always say if you don't have a complication or if you haven't had to do a revision of your own surgery, you're either lying or you don't operate, right? Every plastic surgeon, every surgeon, no matter how good they are, has some cases that don't go as initially intended. You know?
Okay.
Obviously, the less trained you are, the higher that risk is. But I would say that everybody can have cases that don't go as well as intended. But yeah, I mean, it's something that as you're trained and you've put in the hours, that chance or that risk is exceptionally low.
Right.
Okay? Because you just know the techniques, you know how to be a safe surgeon and a good surgeon,
If something
and you're
goes
well
wrong,
rehearsed.
you know what
and
to
you know
do.
how to treat it.
So your reputation obviously is very important.
Yes.
Yeah. Dr. Babak Dadvand, we're talking to him. He's a plastic surgeon, and we're going to get a little more into the details and everything. But obviously, you cover just about any procedure, right? I mean, face, breast, body, and even non-surgical stuff, which is what? Botox and things like that?
Botox and fillers.
And
Absolutely,
fillers.
yeah.
So now that's...
Can I ask a question about that?
Sure.
no, you can't. You got to go home.
Sorry.
What are you doing here?
I mean, not that I would ever do it, but if I were to do Botox with this little thing here, is it important to not go to a med spa and go to a doctor, even if it's like a one little wrinkle?
Listen, I think I'm not obnoxious or egotistical enough to say that only a board-certified plastic surgeon is able to do this. I think someone who's had the training to do
Yeah.
it, knows the anatomy, knows the potential risks and complications, and has done a number of these, so they're well practiced. You should be fine.
Okay, good. I'm headed to Zora, I think is her name. I'm just kidding. I'm going to him. Trust me. No,
Yeah.
because that's a question I get. A lot of women are like whisper about, but no one knows the answer to.
Right.
Yeah.
Now you do.
Now I do, ladies.
Yeah, and that's another important thing is it's not only for women. I mean, you have male patients as well, like men that have breasts and stuff like that. What's that condition called?
Yeah, so it's gynecomastia, and it's interesting. So I'm a board-certified plastic surgeon. I do the full gamut of cosmetic plastic surgeries, but in the last probably 5 or 6 years, I've built up this niche as the go-to guy for gynecomastia surgery or male breast reduction. And it's amazing to me how common of an issue it is, but how not really seriously it's taken or kind of joked about still, whether it's in pop culture or just between friends and so on. But I see a lot of issues with guys with this condition, and living in Southern California, it's kind of tough.
Yeah,
there's
you
a
go
beach,
out
there are
and-
pools, there's
The image is everything.
Yeah, but
Yeah.
also it's an active town where people take their shirts off at the beach or pool party. And to get inside these guys' heads and what they deal with on a daily basis, it's actually pretty impactful.
Right.
How
It
much
can be
it
embarrassing
can
and
affect them. Yeah.
stressful. Yeah. And that's interesting because yesterday we had a woman and we talked about bras and breasts, and she was saying also how it's more common, just like you said now, than we think.
Yeah.
Right? Men having breast problems.
Yeah,
and things.
some studies show up to 30% of men are unhappy with the size of their chest. And it's interesting. I kind of got into it about 6 years ago when my own male patients who I was treating for other things, whether it was injectables or liposuction or facial things, were asking me about their own chests, and kind of looked around the community and I said, no one's really focusing on this. And so
Right.
in an attempt to kind of treat my own male patients, I started to focus more and more of my energy to the point where now it's probably it absolutely is one of the most common surgeries that I do. I probably do last year, I think over 150 of these, and
Wow.
and I see them all age ranges, from as young as 14 to as old as 64, 65.
Is it a condition, or is it obesity, or is it hormones? Tell me.
Yeah, so that's a great question. There's it's definitely a condition, and what it really means, if you break down that word gynecomastia, it just means like feminine breast, and it usually means it's excess breast tissue. Now there could be some excess fat, but people who are just obese and have fatty chest, that's not true gynecomastia, because if they lost that weight, their chest would likely go down. In true gynecomastia, whether you work out at the gym 4 hours a day doing pec exercises or lose 50 pounds, your chest won't ever go down because that breast tissue is resistant to weight loss. And in fact, a lot of guys, they start going to the gym to try and quote unquote melt it away, but this tissue sitting on top of the pec muscle, it just pushes it out farther, and they get really frustrated. And they just stop working out, and they get kind of depressed and down about it.
Yeah. So then they have you to solve that problem.
Right.
Now, do you think do you think it's a result also of like maybe extra estrogen in the body or something?
Yeah, so
right?
For a lot of causes, there are a lot of different causes. I mean, some of the obvious ones are steroid use.
Really?
That's the most common I've heard, yeah.
Wow.
But there's some kind of hormone imbalance leads to it, and usually in favor of estrogen, because then the estrogen stimulates that breast tissue to grow.
I see.
And we were talking about bullying, right? Earlier on, did I feel bullied? And I see teenagers in my office quite a bit, and that's a age group where a lot of boys can develop it. Some studies show up to 40% of boys
got to be the roughest thing
going
in the
through
world.
puberty
Yeah.
can develop gynecomastia. Now, fortunately, most of them it goes away in a couple of years, but I see that 1% that it doesn't, and they come in at the age of 15, 16. I've had cases where the parents had to pull their kids out of school and homeschooled because they were bullied so much, and they start withdrawing. They don't want to participate in gym, that sort of thing. And for me, when I see a teenager who has this, I first ask them, how long have you had it? If it's less than 3 years, I'm likely not going to operate on them, because like I said, most of them it goes away. But if it's been more than 3 years and they don't have any other hormone imbalances or any other funky medical history, I'll operate on them. Because why put an arbitrary number, wait till you're 18, wait till you're 20.
Right.
Why? There's no evidence to say that it'll get better if you wait 2 more years as opposed to the first 4.
That's true, yeah. It just makes your self-confidence
Oh, my
worse,
God, I can't even imagine.
Yeah.
I really can't, because it's like right at that time when everyone's looking at the bodies so intensely, and really breasts are everything.
Right.
Like boobs for, guys are thinking about it, women are thinking about it, and then for a guy to have that, it's just dreadful.
And they're already going through so many other physical changes.
Exactly.
With
Like
skin
acne
problems,
and
pimples,
not
facial
a good time.
hair, that
No.
sort of stuff.
So I would, if I ever had a kid like that, and it had been more than 3 years, and you felt it was medically safe, I have no issue with getting that fixed.
Yeah.
Yeah. No, that's true. And, there's a lot of things, obviously, if people could do something about their bodies, they would probably reinvent them or something, A lot of people, I think most people are not happy with their bodies. At least that's what I read.
Especially Los Angeles.
Yeah, I guess, yeah.
And
But,
Sam, one thing you mentioned too, men are a lot more open to plastic surgery now than they were maybe 10 years ago. And I think
really?
that's part of this kind of paradigm shift in society. Like, it's just more talked about. There are more TV shows
It's in pop
about
culture
it.
now,
and they're seeing it's not just like celebrities and super wealthy, women. It's all ages, both genders, and they're coming in more for these procedures. And I always see these guys coming in. Some of them still say, I didn't even know there was a name for this. I didn't even know something could be done, and I just happened to find it on the internet. And so I think it's slowly getting more and more talked about, and it's good.
So you're a lifesaver for these people,
I'm a quality of lifesaver.
I like that. Hashtag
that's
quality
true.
of lifesaver.
Yeah.
That's true, though. I mean, I've had friends that have had reconstruction like on their noses, and it's just changed their entire lives. And you wouldn't know. It's not a perky thing. It's a bump or a hook or something that they look at every single day and
and they see it stands out,
and it's changed their lives.
Right.
So I think the stigma, at least in LA, of course it is, but I think because it trickled into pop culture, has gone away a little bit. Of if you have this and you get something, it's not like, oh, she has a nose job. I remember growing up, that was the thing.
Right.
And then literally in the last 5-10 years, it's just changed.
Yeah, and I think it's the same with injections too.
Yeah,
Botox.
absolutely.
I mean, a lot of celebrities have come out talking about how they've gotten Botox, and it's really no big deal. I mean, I bet you if you line up 100 people, at least 50 of them have had some kind of injectable, and I probably even higher number have had some kind of, aesthetic treatment, whether it's a peel or a laser or microdermabrasion. It really is. These are little things that you can do to make yourself feel good and get your outside to start matching how you feel on the inside.
Yeah. And, I guess when you're busy, you do several of these a day, right? I mean, yeah. So
there's Botox parties. You can go have them when you hang out and they come. Boop, boop, boop.
Oh, really?
Oh, yeah.
Yeah.
I don't know if that's safe, but I've heard those on Real Housewives.
Yeah. But every day you have different kinds of procedures and everything like this. Yeah. I mean, if you did like 150 of those just in the past, a year, that's a lot of work that you're doing and a lot of people you're helping, which is very cool. For those of you joining us, we're talking to Dr. Babak Dadvand. Am I saying it correctly?
You're
Dadvand.
perfect. 2 for 2.
Nice
there
job,
you go.
Sam.
I'm trying. I'm sure I'm not saying it 100%, but that's okay.
It took me 8 years to say my own name correctly. So the fact that you're getting it on the first and second
Gold
try,
star.
fantastic.
There you go.
Have you ever seen people who are addicted to play and you can tell?
Absolutely.
Is it easy to tell?
Oh, it's easy to tell. It takes a certain bit of skill to kind of let them off easy, and to tell them that maybe this isn't the right thing for you to be doing, or maybe I'm not the right surgeon for you. And it's I think one of the tip-offs is somebody who comes in, and it's not necessarily the person who has the huge lips or the super pulled and shiny face. Right. Yeah. That's anybody can tell, right? I mean, you don't have to be a plastic surgeon to know that person has some kind of underlying psychological issue. The more subtle one is someone who comes in, and whether it's their nose or their breast, and they say, doc, I can't leave the house. I can't have a relationship because of my nose. And you're kind of looking at their nose, and it's not bad, but it should not be anything that's keeping them from living a life. And then you start to wonder, okay, if you take this patient on as a surgery, and you do the surgery, are they still going to be unhappy? Because are you trying to treat something inside their head by doing a physical outward surgery?
Yeah. So you have to think about it.
And that's the skill that you develop in practice. The more you start to speak with patients and you start to see the different nuances in people's psychology, it's interesting. As a plastic surgeon, you're not just a doctor. Sometimes you're like a psychologist or a therapist.
Right?
I mean, people tell you their deepest secrets. You hear about relationship issues, and you have to take all that in and still come to a really safe and sound medical decision for that patient. And like I always say, when you operate on someone, that relationship is going to be there now, and you're responsible. So it's always easy to know who to operate on. It's always a skill to know who not to operate on.
Yeah, that's true. Mm-hmm. That's true, yeah.
You want a reluctant surgeon sometimes. You don't want an aggressive. Especially plastic surgery, I would want, if I ever had it, I'd be someone very reluctant to do anything big or big changes, because then it's like I'm not myself.
Yeah. That's true. You guys can follow us by going to the website, drdadvandplasticsurgery.com. If you don't remember that, I would imagine if someone just Googled your last name, they'd probably find you, right?
Yeah.
In plastic surgery or something.
Even if they got kind of close with the spelling, I should probably come up.
Yeah. Dadvand. It's pretty simple, folks. So you can find out more about the services and everything. Beautiful website. It's got a lot of stuff on here. You have pictures of everything and very interesting. So now so when someone's ready for something like this, they come to you for a consultation first,
yes,
right?
Absolutely. That's the most important thing.
And you do turn people down, right?
Yeah, I mean, there are cases where I just say, look, I don't think you should have this done. I don't think this is going to make an improvement, or I'm not the right surgeon for you. There's it's just not ethically responsible to just operate on everybody. This is surgery. This is impacting people's lives. And when you do a lot of plastic surgery, you also see a lot of patients who come in for revisions, meaning they've had it somewhere else and it didn't go so well. And you realize they initially went for something relatively straightforward, wanting it to enhance them, and now it's become the bane of their existence. And it's a problem, and it's caused pain, it's caused psychological or physical pain, and you want to make sure that you're not that initial doctor. And so you always want to make sure that you're making a decision in their best interest and not just for the money or to have a surgery or a case, because money comes and goes. And in my opinion, relationships are there for a long term. So
that's true.
That's so interesting. My mom had a very minor surgery, and my dad asked the guy who recommended, who would you have your wife be operated on? And he said, this guy. And so they went to this guy. It was very laparoscopic, right through the belly button, and she crashed on the table. And thank God they had researched and done their diligence, because he knew what to do. He went in like MASH style, got that spleen out, but like they thought about which surgeon would work best.
Right.
And they prepared, which I thought was really interesting. Not just, oh yeah, whoever,
Yeah, it's very important. I mean, we sometimes spend more time, reviewing or looking up the restaurants we're going to eat at on Yelp or on internet than the surgeon that's going to operate on us.
True.
And I think that's always been a kind of a shocking thing for me, that people research these things that are really not a big deal, like where you're going to eat, as opposed to someone who's going to actually put a scalpel to them.
Right.
That's so true.
That's true, yeah.
I wish there was a Yelp for doctors.
Well, there are doctors on Yelp, but like
you know what I mean?
Yeah.
Yeah. But maybe that's not the way to find a doctor on Yelp.
Well, it's better than nothing, right?
Well,
like,
but you probably want referrals or something, right?
Yeah.
I mean, you want somebody good,
Yeah, and I want to hear what other people's responses have been in there. Yeah, exactly.
My advice to patients is, you go to more than one consultation. Even for me, when someone comes to me, I say, go to a couple more consultations, and you go based on several things: the surgeon's experience, their results from prior surgeries, but also this kind of like
vibe, right?
Like vibe, this gut feeling of how you feel like you get on with that surgeon, because the surgeon's interviewing you just as much as you're interviewing them, right? I look at patients and, am I the right doctor, or is that patient the right fit for me, for my practice? And it goes both ways. And I think they should take all those things into consideration, not just the cost, not just, the location or what have you. I think it's all those things, but there's a gut feeling that patients have towards a physician, and it's vice versa too.
Right.
And don't deny that. Yeah, my mom had that gut feeling. She said, this is the one. Don't deny that instinct, that vibe, even if it's kind of woohoo.
Right.
Yeah. Now, I see you're friendly with the LGBT community and everything, transgender and all that. Do you do those kind of surgeries
so
too?
That's another niche of mine that I'm really proud of and excited about. I do transgender top surgery, so I don't do below the belt, but above the belt, breasts and face. So whether it's F to M or female to male or M to F. And the reason why I'm particularly proud about that is because I feel like in the next 5 years, the transgender community is going to go through a lot of the barriers being broken down that the LGBT or the LGB community went through, 5 years ago.
It's the new LG, absolutely.
Yeah, with the, more acceptance, laws that are, despite the North Carolina bathroom bill that's passed, which actually is a blessing in disguise if you think about it, because it brought up such an uproar against it, and companies pulling out of North Carolina
and Target doing their whole
and I think that it's just raised awareness, and it's just in its early stages. I think Caitlyn Jenner, whatever you may think about Caitlyn Jenner, from a pop culture standpoint, the strides that she made, and living that public of a life for 60 some years before and then transitioning, I think it just opens it up, and I'm pretty excited to see what happens in the next 5 years with the transgender community.
Yeah.
As a pop culture person, as soon as it gets into pop culture, now we can talk about it.
Absolutely.
And it trickles, and then it's just normal conversation.
Yeah.
So as soon as you hit pop culture, you're on your way.
Right. And I think, those patients for me they're exceptional. I mean, it's one of the most satisfying surgeries that I do. Probably, I would actually say it's the most satisfying surgery that I do, other than, say, the reconstructive surgeries for cancer reconstruction, so on. But the day of the reveal on those surgeries, it's amazing. I mean, from my standpoint, there's usually tears on the patient's standpoint, or especially when they have family support too. The family's in the room when I take the dressings off sometimes, and there's waterworks, and it's really cool.
Right. So you do this. You're not judgmental. You do your work. You help people, and I mean, it's noble, because the thing is that I can't imagine something that would be more difficult to go through than if you feel you're in the wrong body.
Yes, and then you take the dressings off and you see what you had always imagined.
Right.
That is like a dream literally coming true.
Yeah, and for me, as a plastic surgeon, I'm a pretty philosophical guy. I understand fully that, there can be a lot of fluff and superficiality in my profession, especially like the cosmetics portion of it. But I always kind of searching for something that makes me feel like I'm impacting somebody's life. And I feel like, I do surgeries that I feel like are not just going to make them look better, but really change the trajectory of their life. And I think in the transgenders, it really is changing the trajectory of their life. I mean, they have a much higher, suicide rate than the average population. And when you get to, like you said, Tori, they can see in the mirror now how they've felt inside since they were maybe 5 years old or as young as they can remember. It's a pretty amazing
It's a miracle
thing
for them, yeah.
Right.
It really
like being
is.
reborn. Huh?
Yeah. It literally is.
Wow. Well, Dr. Dadvand, everybody can go to the website and just Google Dadvand, Dadvand, board-certified plastic surgeon in Beverly Hills. I know that, I'm feeling a lot more secure if I wanted to do something like this, knowing your background, your abilities, and so forth. I wanted to ask you, as far as like breast augmentation, we were talking about that yesterday. Do you find that women come in who don't really need it, or you feel they don't really need it?
Yeah, there's always going to be that percentage of patient. Need is always an interesting word with plastic surgery. Do you really need any of it? It's not a liver transplant, right?
Right.
You're not going to die.
But you're right. It's more of a, will it help you live a more fulfilling life? And I think that's a very subjective thing. I don't try and push my opinion on what a patient wants as far as, say, breast augmentation. If someone has, in my opinion, a good sized breast, but they want to go larger, as long as they're not going so much larger that it's going to cause problems down the line, meaning implants that are going to overstretch them or cause issues down the line, then I think that's fine.
Yeah. So you find people that, or women that have not necessarily small breasts, but they just want to change the shape.
Yeah, and I see, especially
like
women who've had either weight loss or pregnancy.
Right.
Like
a lot of women feel that after pregnancy or breastfeeding that their breasts have deflated, and there's nothing that you can do to
That's what she was
fix
saying
that.
yesterday. There's nothing you can work out or eat. Yeah,
That's true.
You know, other than just gaining a lot of weight, which is not healthy. So I think in those women, it really is a great surgery, and it restores their sense of femininity, that what they had before they had kids.
And like we were saying yesterday, not a lot of people would probably notice, but they notice.
They notice.
They feel it, right? So it's like it's not a huge boob lift. It's just like they feel the difference.
Right, and a lot of the women in my practice, they're not coming in for the huge implants.
Is that popular anymore even?
I mean, I think it'll always be popular in some segments.
Yeah,
you know,
the 90s was
but
like...
yeah, it was a go big or go home mentality, right? But I think overall, in everything, people want to look more enhanced, but more naturally enhanced and rejuvenated. Whether it's fillers, so people are veering away from overfilling, over-injecting. There's also going away from overinflating as far as implants, because most women don't want that. And as a woman gets older, and they have large breast implants, they're just going to feel top-heavy, matronly, kind of
weird,
fat,
Right.
And a lot of women coming in their late 40s and 50s who've had implants in the 80s and 90s want to go smaller.
Yeah, I hear a lot of reduction on the implants in pop culture too.
Yeah.
Like you see those Baywatch babes or Kendra Wilkinson, she's like, I don't want it anymore. I can't handle it.
Right.
Out.
Yeah.
Go small or go home.
That's right. That's a new Texas bumper sticker.
That's right.
Yeah. So if you guys are interested in any of these procedures, what's FTM top surgery?
So that's female to male
okay.
top surgery for transgender.
And then MTF, which is the other way around.
Right.
Body, face, non-surgical. So you guys can pretty much remake yourselves. Spend a week with Dr. Dadvand, you'll
Done.
Totally different person. Wow. And so people can find you through the website. We can also give out the phone number.
Yeah,
Should I give that out? It's 310-278-4200. You're in Beverly Hills, so it's easy to get to and everything. Thank you so much for joining
This
us.
was so
Sam,
fascinating.
Tori, it was a
Fascinating. You're
pleasure.
full of a lot of information. And guys, go to the website, check out some more information on this. There's a lot of images before and after and so forth, so you can see really the work, And you've got it in like 1 million pages, this website, which is amazing.
And one thing I'll say,
in
Sam,
different languages, I meant, yeah.
Yeah, but I wrote every word of that website.
Wow.
Really?
Yeah, it
Good for you.
took a long time, but yeah, I wanted to be something that came from my mouth. So.
Right.
This guy's like
Amazing.
a Renaissance guy.
Yeah, I'm
The oil
telling
painter,
you.
violinist,
I'm
slash
telling
writer.
you, yeah. I know. He's going to be, like, the next thing he's going to do is play violin and
Right.
be like
I feel like he's going to dance out of here on
prodigy,
like Mikhail Baryshnikov toes or something. All right, see ya.
I was a pretty good break dancer back in the 80s.
course you were.
Actually. I had my parachute pants. So.
Who didn't?
All right. Well, thanks again for joining
Thank
us.
you,
All the
Sam.
best to you.
Thank you very much. Thank you, Tori.
Absolutely.
Of course. Thanks, everybody, for listening. Thank you, Tori.
Absolutely.
And we'll see
TGIF,
you-
guys.
Yes, Monday. See you then.
You're listening to Sam in the Morning, only on LA Talk Radio.